Ladies and gentlemen, welcome to All India Radio Houston. Sorry, we got jammed. The computer froze, so I had to restart the computer. And welcome to All India Radio. I am Dr. Nik Nikam. You're listening to 1090 AM KULF Radio, and you can also listen to us on kulfradio.com, or you can watch this on live YouTube under my blog, Nik Nikam. Now we're going to talk about Ebola crisis 2014. Is there an Ebola crisis? Okay, what is an Ebola? Well, Ebola is a virus, and Ebola virus is quite different from the ordinary flu virus that we get, in that Ebola virus is known as a zoonotic virus. What is a zoonotic virus? I mean, you heard of the word zoo, which refers to the place where you keep animals. That means this virus resides mostly in the animal kingdom, particularly the bats. That's where it is supposed to be residing. However, when this virus is in these animal kingdom, they don't cause much problem. However, when this virus gets into human body, we'll tell you how it gets into the human body, then it can create a severe reaction in the human body, which can lead to all kinds of symptoms which Ebola virus infection causes, and with a pretty high mortality. So how did this Ebola virus became such a major health issue? Well, back in March 2014, in West Africa, especially in cities like Guinea, Liberia, Syria, Sierra Leone, Nigeria, these places, there was an outbreak of this Ebola virus. The Ebola virus has been recognized since 1976 in the city of Zaire. And since then, there have been episodes of Ebola virus. And the worst thing about Ebola virus is that it has pretty high mortality, ranging anywhere from 25 to 100% mortality. That's why it is considered a deadly virus. Okay, so this current Ebola crisis began in March in 2014, and it has become progressively worse over the course of several months. As a result, the number of people infected and the number of deaths involved in this particular episode is far exceeding the combination of all the episodes in the past years since 1976. That's why the World Health Organization has taken a very active step in trying to deal with this Ebola virus. Now let's talk about how does the Ebola virus get from an animal such as a bat into human beings and start creating all this havoc that we have been hearing about. Well, as I said, the Ebola virus resides in these animal tissues, like the bats, chimpanzees, and all these things. We as human beings are very adventurous. You know, we go into the forest, we hunt animals, we kill animals, we get cuts and bruises, and when we are exposed to these animals that are carrying these viruses, and these viruses get into our body, and once they get into our body, they start doing the magic, just like the alcohol when it gets into your stomach. And when it's too much, it starts creating havoc. In the same way, the virus, when it gets into your system, it starts creating havoc. Okay, the Ebola virus, when it gets into the human body, it takes about anywhere from 3 to 3 weeks for it to reach its peak. That's called the incubation period. So the way you get Ebola virus is by coming in contact with these animals which have this virus, or people who are actively infected with this virus and whom you're trying to help, like a family member. Then when you're exposed to their body fluids like urine, saliva, or feces, or even blood, then when you get in close contact with these elements, you have a very high chance of contracting Ebola virus. When the Ebola virus starts multiplying in your body, then it begins to cause all these various symptoms. So let's talk about what are the symptoms that are related to Ebola virus infection. As I said, after an incubation period of 3 days to 3 weeks, then you see a full-blown picture of high fever, headache, sore throat, muscle aches, and sudden intense weakness. One of the other deadly aspects of this Ebola virus is people have severe diarrhea and vomiting, which can lead to severe dehydration. And this severe dehydration with electrolyte imbalances can lead to kidney failure. The severe dehydration leads to drop in blood pressure, and that leads to shock, which can affect kidney function seriously. Another important aspect about Ebola virus we need to keep in mind is this Ebola virus has a tendency to disrupt the clotting mechanism in the human body, which can lead to bleeding or coagulation. That is, sometimes you bleed, sometimes the blood clots in your body, and that can have very devastating effect on various organs of the body, all the way from head to toe. In addition, Ebola virus also causes a severe skin reaction. People may come with rashes, and some people may have huge blisters. A combination of all of these factors developing over a very short period of a few days taxes the human body to the extent that you totally collapse. And unless we address these things that are going wrong, the mortality rapidly goes up. That brings us to the question of prognosis. Let's talk about the prognosis of Ebola virus infection. Before that, I would like to identify the station here. The station is, I'm Dr. Nik Nikam, and we are talking about Ebola Crisis 2014. This is a documentary, and you're listening to 1090 AM KULF radio in Houston, Texas. And you can also watch this on YouTube under my blog, Nik Nikam. That is Nikam. What is the prognosis of people who are affected with this Ebola virus? If you look at the reports all across the globe, mostly in South Africa, where from 1976 to 2014, the mortality has ranged anywhere from 25 to almost 100%. The most frightening thing about this current outbreak of Ebola virus is the fact that the mortality from this Ebola virus outbreak has reached almost 60%. Since it started in April, as of August 2014, there have been almost 2,000 cases of Ebola virus reported in all these various parts of West Africa we talked about. And out of that, there are more than 1,000 people have died. So the mortality is approaching almost like 60%, which is pretty high. And you also have heard about some of the doctors and the healthcare workers who have been trying to help these people have become infected with this virus. And as a matter of fact, Samuel Brisbane, a former advisor to the Libyan Ministry of Health and Social Welfare, died from this Ebola virus. Another doctor who was helping these people also died. There were 2 people who were evacuated from West Africa to the Emory at Atlanta for treatment after finding out these people were exposed to Ebola virus. And now let's talk about if this Ebola virus has been in existence since 1976, how come we don't have a vaccine? I mean, we have vaccine for polio, we have vaccines for mumps and measles, we even have a vaccine for flu. How come we don't have a vaccine for Ebola virus? Well, Ebola virus, for the most part, as I said, is in animals, like bats, bush meat, like that. And there hasn't been much research done on producing a vaccine, except for one company called as the MAP, which has produced a very limited amount of antibodies to this Ebola virus antigens, or the toxic substances that are produced by the Ebola virus in the human body. In fact, Dr. Brantley from United States and the other health worker were given these vaccinations experimental treatments before they were transported to the Emory University for treatment and supportive care. Ladies and gentlemen, you're listening to All India Radio Houston. I am Dr. Nik Nikam, and we are talking about Ebola crisis 2014 and what are the things that we need to know about Ebola crisis. This will be on YouTube later on. You'll be able to watch it. And let's talk about how serious is the Ebola crisis. Even though Ebola has been, for the most part, restricted to the West African region, there's always a fear, can this Ebola spread to other countries? In fact, there are people who have traveled from Nigeria, from West Africa to other countries, and they have come down with fevers and raised questions about whether they have come with Ebola virus. In fact, one of the travelers who came to New York and was admitted to the hospital with high fever and these various symptoms, was a concern as to whether he had Ebola virus. Of course, the blood test did not show up any evidence for Ebola virus. Similarly, recently, another traveler who came from Nigeria to Canada was also admitted to the hospital with similar symptoms, raising the question as to whether that person has Ebola. So travel can easily spread these kind of illnesses from a localized region to worldwide areas because of travel. And the question is, can this Ebola be a major epidemic all across the globe? Like the Middle East respiratory virus syndrome or the SARS, most of which are transmitted through air droplets, similar to the common flu. If you have a flu and if you're sneezing and coughing and hacking, and if somebody is just close to you, and they will be, or even in the room, they will be able to catch those symptoms. And could this happen with Ebola virus? Well, the fact is, Ebola virus is transmitted through mostly body fluids, which are urine, feces, saliva, sweat, or blood. So the chances of these body fluids getting to a large population is very limited, especially if we can, one, isolate these patients at the earliest and try to take all precautions in preventing these body fluids being exposed to the family members and especially the healthcare workers. But that is one thing that we need to keep in mind, because if we don't contain this, and what has happened in West Africa is that the family members are not very well aware of the consequences of being in close proximity to these patients who are severely infected with the virus. As a result, they have the highest chance of getting this Ebola virus transmitted from one member of the family to the other. And again, remember that when these patients die, then there's a lot of rituals that are done by touching the patient and doing all kinds of ceremonies which can actually spread the virus from the dead body to all the family members who are around that. So the best part to prevent the spread of virus is to isolate ourselves, isolate the patient who has the virus, and then treat them appropriately. Talking about treatment. Okay, let's talk about treatment. What is the treatment for Ebola virus? Well, actually, there is no specific treatment for Ebola virus. It's going to be mostly supportive in terms of bringing down the fever. And I told you, these people are prone for severe dehydration and shock. They lose a lot of body fluids, and all these body fluids, electrolytes, and chemicals have to be replaced so that the body will be able to function normally and will be able to maintain blood pressure and preserve kidney function. The virus runs a course of approximately 3 weeks, and if we can support these patients during these 3 weeks with fluids and other supportive measures, and isolate this patient so that other healthcare workers or family members are not exposed to this in an unusual manner. And that is the best we have to offer at this present time. They are working on a vaccine, but it's not going to be anytime soon. Even if it's available, it's going to be somewhere in 2015 that we may have a vaccine that may be able to address the Ebola virus infection. Okay, if we can't treat this, and if it is highly contagious to people who are around them, like the healthcare workers and the family members, the next question is, how do we prevent Ebola virus spreading from an infected patient or from a person who has died to other members in the community? Okay, the prevention is probably the best approach in terms of avoiding getting Ebola virus infection. So the best thing is to isolate the patient and keep them in a separate place and keep all the family members away from the patient and minimize the contact of these bodily fluids, namely the saliva, the secretions, the urine, the feces, or even coming in contact with the blood. And the second step is to wash hands with soap, so it would kill any type of organisms there. And the third thing is to avoid handshakes, which can transmit these bacteria from person to person. And of course, the bush meat, which is a very which is a delicacy in West Africa, is supposed to be one of the carriers of this virus. So avoiding coming in contact with these bats and avoiding meats that may be contaminated, like chimpanzee and bush meat and all these things, would help to minimize the spread of virus from person to person. Okay, how do we educate the public? Because in countries where communication is very limited, and when people have their own doubts, in fact, the people in West Africa are concerned that the health workers coming from other parts of the world are in fact spreading these viruses to other people in the community. But we have to educate these patients. And in order to address that, a rap group in West Africa came up with this Ebola in Town rap song, which became very popular in the first quarter of 2014. Maybe you can go to YouTube and listen to this beautiful rap song. Of course, this is in West African language, which I was not able to understand. But nonetheless, it just shows how people can come to educate people in a language and in a medium which they all like to, If it's a rap song which is telling them how to keep away from people with infected viruses and how to take precautionary measures, I think that's a great educational tool. Now let's move on to and how is the world response for this Ebola virus? There's been a tremendous response from all over the globe, all the way from the United States, where the CDC has sent more than 60 members, experts, to evaluate and advise as to how to deal with this Ebola virus outbreak, along with the World Health Organization, which has recently declared a healthcare emergency with reference to Ebola virus outbreak. There have been millions of dollars, almost $200 million have been pledged by the World Bank, and also the World Health Organization is mobilizing millions of dollars and resources and people to make sure that we can contain this Ebola virus infection in a localized place and allow time for these viruses to kind of dissipate into the sort of a quiet phase. So, ladies and gentlemen, Ebola crisis is real. It has a pretty high mortality, and in conclusion, Ebola virus begins from animals such as bats and chimpanzees who harbor these viruses. And when these viruses come in contact with human beings from hunting or eating these kind of meat, then it multiplies in the human body. When it multiplies in the human body, after 3 weeks, then the patients come up with a full-blown episode of Ebola virus infection, which is characterized by fever, aches, stomach cramps, diarrhea, vomiting, severe dehydration, kidney failure, bleeding problems, and skin rashes. And the only treatment we have for these patients is supportive treatment, supporting their blood pressure, supporting their fluids, and keeping them isolated so that other people don't get infected. At the present time, we don't have a vaccine. An experimental vaccine has been tried on 2 American patients, but at the present time, we don't have a vaccine. But nonetheless, with this world awareness about Ebola virus, hopefully maybe we can contain this to just West Africa and minimize the spread to the rest of the world. Ladies and gentlemen, you're listening to All India Radio Houston. I am Dr. Nik Nikam, and hopefully you have learned something from this brief presentation on Ebola virus. That's all the time we have, and you can watch this on YouTube under my blog, Nik Nikam. Thank you for tuning in. And this is my friend is here, and
hello everybody.
Hello. And next week we will be here in All India Radio, and we